I have been a doctor for over 2 decades. I have sat across from patients in examination rooms and delivered news that changed their lives in seconds. I have held the hands of families in hallways outside intensive care units. I have signed death certificates for people who walked into my hospital on their own 2 feet just days before. And in all of that time, across all of those years, there is one thing I have never once done in a routine appointment with a patient over 60. I have never warned them about hantavirus, not once. And I am standing here today to tell you that this is one of the greatest failures of modern preventive medicine for seniors. Because while your doctor has spent years talking to you about cholesterol, about blood sugar, about bone density and joint health, there has been a virus sitting quietly in the background of everyday life in this country and around the world. A virus that has been known to science for decades. A virus that can take a perfectly healthy person from feeling mildly unwell to fighting for their life on a ventilator in under 72 hours. A virus that kills by drowning its victims from the inside. And a virus that your doctor has almost certainly never mentioned to you by name. And that is why the silence around this virus ends today. My name is Dr. Samuel Hart. And what I'm about to tell you is something I wish every one of my patients over 60 had heard years ago. Not because I want you to be afraid. Fear is not medicine. Fear does not save lives. But knowledge does, preparation does, and the 3 things I'm going to give you before this video ends absolutely do. Stay with me. Every word of this matters. A group of passengers boarded a cruise ship departing from Argentina earlier this year. They were travelers, retirees, people who had saved for that trip, packed their bags with excitement, and walked onto that ship looking forward to the kind of rest and adventure that people over 60 have earned. What happened on that ship in the days that followed was not reported with the seriousness it deserved. Because what happened on that ship was not a freak accident. It was not a mysterious anomaly. It was the entirely predictable result of a virus that has been circulating on this planet for longer than any living person has been alive, suddenly finding its way into a closed environment filled with people who had never been told it existed. One passenger became ill 5 days into the voyage. 10 days after that, he was gone. His wife, who had been at his side throughout, collapsed at an airport in South Africa and did not survive. Another passenger was evacuated to intensive care. Another stopped breathing on board. By the time medical investigators had completed their work, 7 confirmed cases had been identified. The ship's own doctor, the one person whose job it was to protect every passenger on that vessel, became ill himself and had to be removed from the ship for treatment. The World Health Organization confirmed it. This was hantavirus, specifically a strain called Andes virus. And unlike most of its family members, Andes virus has the documented ability to pass directly from one human being to another. Now I need you to sit with that for a moment, because here is what that headline did not tell you. Here is what the news anchor did not explain before moving on to the weather forecast. The virus responsible for those deaths on that ship is not new. It is not a mutation. It is not something that emerged from a laboratory or crossed a species barrier last year. Andes virus has been known to medical science since 1995. The fact that human-to-human transmission was possible has been documented since 1996. There was an outbreak in 2018 that resulted in 34 infections and 11 deaths. And every piece of that data has been sitting in peer-reviewed medical literature for years. And yet when those passengers boarded that ship, not one of them had ever been warned. I am going to tell you exactly why that is, and I am going to make sure that you are never in that position again. Before I go any further, I need to make sure you understand what hantavirus actually is, because the name alone tells you very little. The hantavirus family is not a single virus. It is a collection of related viruses, each one slightly different, each one hosted in a specific rodent population, and each one capable of making human beings catastrophically ill in its own particular way. The family gets its name from the Hantan River in Korea, where in 1951, United Nations troops stationed along the riverbank began reporting a devastating hemorrhagic fever that ended in kidney failure. At the time, nobody knew what was causing it. Soldiers were falling ill and dying, and the medical teams treating them had no name to put on what they were seeing. It was not until 1978, 27 years after that first outbreak, that a Korean scientist named Dr. Ho-Wang Lee was able to isolate and identify the virus responsible. He named it Hantavirus, after the river where it had first been observed in modern medical terms. What Dr. Lee also confirmed was something that changed the understanding of this disease entirely. The virus lived in rodents. Infected rodents shed it in their urine, their droppings, and their saliva. When those materials dried out and became airborne particles, any human being who inhaled them was exposed. You did not have to touch the rodent. You did not have to be bitten. You simply had to breathe the same air where a contaminated surface had been disturbed. Ancient Chinese medical texts, some dating back thousands of years, describe fever diseases that ended in kidney and lung failure in terms that researchers now believe were almost certainly describing hantavirus infections. This virus has been moving through human populations silently and without a name for longer than recorded medicine has existed. When scientists began applying modern genomic sequencing to viruses around the world, they discovered that many geographically distinct viruses shared the same fundamental genetic architecture as Hantavirus. Korea, China, Japan, Russia, Scandinavia, every continent with a rodent population, which is to say every continent on Earth, had its own local variant. Each variant had adapted to its own local rodent host. And each one, when it crossed into a human being, produced one of two catastrophic outcomes. Either it attacked the kidneys, causing them to shut down in a cascade of hemorrhagic failure, or it attacked the lungs, flooding them with fluid until the person could no longer breathe. There is no middle ground with this virus. When it decides to make someone ill, it does so with extraordinary speed. And the people it tends to hit hardest are the people whose immune systems are not operating at full strength. If you are over 60, I need you to hear this clearly. You are in that category. Not because you are weak, not because there is something wrong with you, but because the immune system, like every other system in the human body, changes with age. The inflammatory responses that once activated quickly and decisively become slower and less precise. The body's ability to identify a novel pathogen and mount an immediate defense is reduced compared to what it was at 35. But it means that when a virus like hantavirus enters the body of someone over 60, and critical illness can be dramatically shorter than it would be in a younger person. This is why I am talking to you today and not to a general audience, because you specifically need this information. And because the medical establishment has spent decades not giving it to you. If you are finding what I am sharing valuable today, I want to ask you something genuine before we go any further. This channel exists for one reason, to give you the medical information that your annual checkup does not, and speak plainly about the things that matter most to your health and your life. If you are not yet subscribed to Thrive After 60, please do that right now, not as a favor to me, but because next week I'm going to cover something that affects over 40% of women over 65. You will not want to miss it. Hit subscribe, turn on the notification bell, and let us keep going because we are only halfway through what you need to know today. Now I want to talk to you about something that I think about often, and that I believe sits at the heart of why seniors are so dangerously underinformed about hantavirus specifically. When a physician completes medical training, they graduate with a mental framework for how to categorize risk. High-frequency diseases get high-frequency attention. The conditions that affect the largest number of people get the most time in medical education, the most prominent placement in clinical guidelines, the most developed set of screening tools and conversation prompts. This is rational from a public health standpoint. If you only have 12 minutes with a patient, you prioritize the threats most likely to affect them. But here is what that system does not account for. It does not account for the emerging threat. The risk that has been quietly growing in the background while clinical attention was directed elsewhere. The disease that was rare in a previous decade and is becoming measurably less rare in this one, not because it has changed, but because the environmental conditions that allow it to reach human beings are shifting with documented consistency. Hantavirus is not the same risk in this decade that it was in 1993. The conditions that drive rodent population explosions, the warm winters, the irregular precipitation cycles, the expanding suburban development pushing built environments into previously rural rodent habitats. These conditions are not decreasing, they are increasing, and the geographic range of confirmed hantavirus cases has expanded accordingly. States and regions that recorded no cases a generation ago are now recording them with regularity. The medical system updates its guidance, but it updates slowly. And in the gap between what the data shows and what your doctor has been formally prompted to discuss with you, there are patients who are not being prepared. This is not a conspiracy. Nobody is hiding this information with malicious intent. The failure is structural, not deliberate, but a structural failure still has consequences. And those consequences fall most heavily on the people who are already least likely to go looking for health information independently, on people who trust that if something were important, their doctor would have told them. You trusted that, and I am here to tell you that on this specific topic, the system let you down. Not anymore. It's time to change that perspective once and for all. There is a quiet assumption embedded in the way preventive medicine communicates with older patients. The things most likely to affect you are the things we already know: cardiovascular disease, diabetes, arthritis. These are the pillars of senior preventive care, and they are important. I am not dismissing them. But the result is that everything outside them gets treated as either too rare to mention or too complicated to explain. Hantavirus falls into that gap. It is not on the checklist that most physicians run through in a standard appointment with a patient over 60. It does not have a vaccine. There is no blood test your doctor orders annually to assess your exposure risk. And because the outbreaks that make news tend to affect young people engaged in outdoor activities, the assumption has calcified over time that this is not a senior health issue. That assumption is wrong. Hantavirus exposure is not primarily a risk for young hikers or campers. It is a risk for anyone who lives in, works in, or passes through environments where infected rodents are present. Think about what that actually means for a person over 60. It means the garage where you store your seasonal items. The garden shed where your tools have been sitting through a mild winter that allowed rodent populations to grow larger than usual. The attic you finally decide to clear out in spring. The basement where boxes have sat undisturbed for years. The vacation cabin your family rents once a year that has been closed up since last autumn. The rural property where a grandchild's birthday party is being held on a warm weekend. The community hall in a small town that is opened for a special event after months of being locked. None of these are extreme scenarios. Every single one of them is an ordinary moment in the life of an ordinary person over 60. And in every single one of them, if an infected rodent has been present, the risk of exposure through disturbed airborne particles is real. This is what nobody is telling you, and this is what I am telling you now. I want to walk you through what hantavirus actually does to the human body when it enters through inhalation. Because I believe that understanding the mechanism is what transforms this from an abstract health warning into something you will genuinely carry with you and act on. When contaminated particles are inhaled, the virus enters the respiratory tract and begins binding to cells that line the blood vessels inside the lungs. These are called endothelial cells, and their job is to maintain the integrity of the vessel walls, to keep the boundary between what is inside the blood vessel and what is outside it intact and functional. Hantavirus targets these cells with remarkable specificity. It attacks the very architecture that keeps your lungs dry and operational. As the virus replicates and the immune response mobilizes, the vessel walls begin to leak. Not dramatically at first, not in a way you would notice from the outside, but fluid begins to seep from the bloodstream into the tissue of the lungs. Slowly at first, and then with accelerating speed as the inflammatory response intensifies. The air sacs responsible for transferring oxygen from the air you breathe into your bloodstream begin to fill with that fluid. Your body, in its extraordinary wisdom, tries to compensate. Your breathing becomes faster and more shallow. Your heart rate increases to try to deliver more blood to oxygen-starved tissues. Your blood pressure begins to behave erratically. And the oxygen saturation of your blood, that number that a pulse oximeter measures when they clip it to your finger in a clinical setting, begins to fall. A blood oxygen saturation reading below 90% is a medical emergency. It means the exchange of oxygen from air to blood is failing. It means the body is, in the most literal physiological sense, beginning to suffocate. For a person over 60 whose cardiovascular system is already managing the natural changes that come with age, whose heart may already be working harder than it once did to maintain adequate circulation, and whose respiratory reserve is reduced compared to a younger person, this cascade can move with terrifying speed. A person who woke up that morning feeling vaguely unwell, perhaps blaming a cold or a sinus issue or the change of weather, can find themselves in respiratory failure within hours. And here is the detail I find most important for you to understand. The period before the acute collapse, the period doctors call the prodrome, feels almost exactly like the flu. Fever, fatigue, muscle aches, headache, nausea, sometimes a dry cough. There is nothing in those early symptoms that screams emergency to a person who is accustomed to managing the ordinary illnesses that come with age. Nothing that says this is different. Nothing that says call for help now and not tomorrow. By the time the breathing difficulties begin, the window for the most effective intervention has often already narrowed significantly. This is not said to frighten you. It is said because knowing this changes what you do with that information. And what you do with that information can be the difference between a recovery and a tragedy. Now, I want to give you the 3 things I promised you at the beginning of this video. These are not suggestions. These are the specific, practical, immediately actionable steps that I give to my own patients and to every member of my own family. They are simple, they cost nothing, and they are grounded in everything I have just walked you through. The first thing I want you to stop doing is disturbing enclosed spaces that have been sealed for months without preparation and protection. If you are planning to clean out a basement, open a storage unit, clear an attic, sort through a shed, or enter any space that has been closed up for an extended period, particularly during the warmer months when rodent activity increases, you need to ventilate that space first. Open it. Walk away. Come back in 30 minutes and let fresh air move through it before you enter and begin disturbing surfaces and materials. If there is any sign that rodents have been present, droppings, gnawed materials, nesting debris, treat that space as requiring careful handling. Do not sweep or vacuum it. Sweeping and vacuuming aerosolizes particles and puts them directly into the air you breathe. Damp mopping and damp wiping with a diluted bleach solution is the correct approach. If you are going to do this work yourself, wear a well-fitting mask rated at least N95, not a surgical mask, an N95. If you are not confident you can do it safely, call someone who can. This one change could be the most protective decision you make for your health this year. The second thing I want you to start doing is paying different attention to early symptoms, particularly after any potential exposure. If you have recently spent time in a rural area, a cabin, a home that has been closed for a season, or an outdoor space with visible rodent activity, or any environment where hantavirus exposure is plausible, and within the following 1 to 5 weeks you develop a fever alongside muscle aches and fatigue, do not wait this out at home the way you might wait out an ordinary cold. Contact your doctor. Tell them where you have been. Tell them you are concerned about potential hantavirus exposure. Use that word specifically, hantavirus, because it is not on the standard checklist. If you do not name it, there is a genuine possibility it will not be considered. You are your own best advocate in that examination room. The words you use matter. Give your doctor the information needed to make the right call quickly. Early recognition is not simply a matter of comfort. In the context of Hantavirus Cardiopulmonary Syndrome, early recognition is the factor that separates a full recovery from a catastrophic outcome. There is no antiviral medication that directly targets this virus. Treatment is supportive, which means the medical team manages your breathing and oxygen levels. The sooner that support begins, the better positioned your body is to do that work. Early hospital arrival leads to significantly better outcomes. The third thing I want you to do is have one specific conversation with your doctor at your next appointment. Ask this question directly. Given the recent confirmed cases and documented risk, what would you recommend for someone my age in terms of environmental precautions? That question tells your doctor you are informed. It puts hantavirus on the table and gives them the opportunity to assess your individual risk. Your doctor knows your geography. There are regions where specific strains are endemic and where the risk profile is genuinely elevated. Ask the question. Write it down before you go so you do not forget it. This conversation costs nothing and could matter more than any supplement on your shelf. Before I bring this to a close, I want to return to the passengers on that cruise ship. The ones who boarded with excitement and expectation and found themselves in the middle of a medical emergency none of them had ever been told to prepare for. Some of those passengers disembarked early before the full picture was understood. They flew home. They returned to their families. They sat across from people they love and told stories about an interrupted vacation without knowing whether they were carrying something that needed immediate medical attention. This is not a criticism of them. They did not know. How could they have known? Nobody had told them. The ship's doctor became ill himself. He was not negligent. He was working with a disease that his standard training had not prepared him to recognize quickly in a population of passengers presenting with what initially looked like ordinary respiratory illness. This is the consequence of the silence I described at the beginning of this video. The silence of a medical system that has treated hantavirus as a niche concern rather than a genuine senior health priority. The silence of a preventive care framework that has not updated its standard patient conversations to reflect the changing geographic spread of this virus, the documented increase in rodent populations driven by shifting environmental patterns, or the proven capacity of at least one family member of this virus to spread from person to person in close contact settings. That silence has a cost, and the people most likely to pay it are the people who were never given the information they needed to protect themselves. You now have that information. Dorothy is 68 years old. She lives in a mid-sized city and spends her weekends at a small property in a rural county about an hour outside of town. Last spring, she noticed signs that mice had been active in the outbuilding over the winter. She was about to sweep it out when she remembered something she had heard. A conversation about an environmental precaution she could not quite place. She was not sure exactly what the concern was or why it mattered, but something made her pause. She called her doctor instead of picking up the broom. She described what she had found. Her doctor took her seriously. He walked her through the correct approach, the ventilation, the damp wiping, the appropriate mask. He also noted that given her age and a mild underlying respiratory condition she managed with medication, she might want to consider having a professional handle the cleanup rather than doing it herself. She did. The outbuilding was cleaned properly. Dorothy spent that spring weekend gardening instead. 3 weeks later, she developed a mild fever and fatigue. She called her doctor on day 2 rather than waiting it out. She mentioned the outbuilding. She mentioned hantavirus by name. Testing was ordered. The result came back negative. Dorothy had a seasonal respiratory virus, nothing more. She recovered in 4 days. But here is what matters about Dorothy's story. Every decision she made that kept her safe, the pause before sweeping, the call to her doctor, the willingness to name the concern and ask the question, came from one thing: information. She had been told what to look for and what to do with it. And so when the moment came, she acted correctly without panic and without delay. That is what this channel is for. That is what Dr. Samuel Hart is here to give you every single week. Not fear, not alarm, not the kind of health content that sends you to bed anxious and unsettled, but the kind of clear, specific, plainly spoken medical knowledge that puts you in Dorothy's position rather than in the position of the passengers on that ship. Knowledge is not a luxury at 60, 65, 70, or beyond. It is a form of protection that no prescription can replace and no annual checkup will reliably provide on its own. You have earned the right to have it, and this channel exists to make sure you always do. Wash your hands thoroughly when you come home and before you eat. Ventilate and protect yourself before entering any enclosed space that has been sealed for months. Pay attention to fever and fatigue following any potential environmental exposure, and name your concern clearly and specifically to your doctor. And know that your body, the extraordinary, resilient, beautifully designed body that has carried you through every decade of your life, responds best when you give it both care and the truth. Take your necessary precautions. Continue on, take care of yourself, and be well. In my next video, Dr. Samuel Hart is going to reveal the 5 foods that over 40% of seniors eat every single morning, believing they are making a healthy choice, and what the research actually shows is happening inside the body as a result. Subscribe now so you do not miss it. And if this video gave you something valuable today, share it with someone you love who is over 60. They deserve to know this too. I am Dr. Samuel Hart, and I will see you in my next video.